Hello coders! Welcome to Fast Coder 21 Pre-Medical Coding YouTube channel. Today we are going to learn one of the most complex CPT coding system, which is musculoskeletal system. Our topic name is Step by Step Musculoskeletal System CPT coding for CPC, Surgery, ED and E&M coders, session 1. Coders, as it is not possible to create whole musculoskeletal system in one session, we have divided sessions based on the requirement. So today we are going to learn session 1. If you would like to know more about remaining sessions, please subscribe to our channel and watch remaining sessions. If you like this session, please click on like button in order to motivate us. And also share with your friends and fellow coders about our channel. In this session, we are going to learn how CPT is divided based on the body parts, and also we are going to learn most important and crucial definitions related to musculoskeletal system coding. So if you know all these definitions, you can code musculoskeletal system CPT coding very easily. So if you want to master in musculoskeletal system coding, please watch this session until the end. So first we will check how does the codes ranged in the musculoskeletal system. So if you see here, musculoskeletal system codes starts from 20,100 to 20,999. So this column is the, this row is the complete musculoskeletal system surgical procedures. So if you go ahead down, so 21,010 to 21,499 includes surgical procedures on the head. And if you see 21,501 to 21,899 includes surgical procedures on the neck, includes soft tissues and thorax. And 21,000 to 21,920 to 21,936 includes surgical procedures on the back and flank. And also 22,102 to 22,899 includes surgical procedures on the spine vertebral column as follows remaining rows. As you see here, in musculoskeletal system, CPT codes are based on or divided on based on the body system which occurs first. In musculoskeletal system, head comes first, then neck, then back and flank, and spine, afterwards abdomen, next shoulder, next humerus and elbow, next forearm and wrist, next hand and fingers, next pelvis and hip joints, next femur and knee joint, next leg and ankle joint, next foot and toes, and next we will use application of cast and strapping, and also we have arthroscopic procedures which are most important in musculoskeletal system CPT coding. Here we need to understand one thing that in musculoskeletal systems, CPT codes are included top to bottom. Like if you take head is the top portion and foot and toes are the bottom portion of the body. So as we have discussed, in order to code musculoskeletal system properly, we need to know most important definitions which are every medical coder needs to know. So our first definition is incision. So what is incision? Incision is a cut made through the skin and soft tissues to facilitate an operation or procedure. So in order to start any type of procedure, incision is the basic requirement. So whenever physician start the procedure, initially he will start with the incision, then he will do remaining procedures. Next is wound exploration. So what is wound exploration? Wound exploration can allow physician to inspect the tissue within the injured zone for identification of any foreign body, non-viable tissue and severity of infection. So basically exploration means examination. So whenever there is a wound, using the exploration technique, physician will inspect the tissues within the injured zone in order to identify any foreign body, non-viable tissue, or severity of the infection. Next one is excision. So what is excision? Excision is the removal of tissue from the body using a scalpel. Usually it is a sharp knife, laser or any other cutting tool. So basically excision is removal of the tissue from the body. Next one is reimplantation. So what is replantation? Replantation indicates reattachment of a body part that was traumatically removed in its entirety from the body. So basically it is the process of reattachments. So whenever there is a trauma, which because of that trauma, if anyone lost, using the replantation technique, physician will reattach that lost body part into the body. Next one is repair. So what is a repair? A repair is fixing something that is already there so that it works. So basically in repair, physician will use sutures or any other techniques in order to repair the wound. Next one is release. So what is release? Release refers to the decompressing or loosening of a tendon, muscle or nerve from surrounding tissue that is binding or impeding movement. So in order to create free movement, physician will remove the surrounding tissue. So which usually call it as release. Usually we will find release of adhesions or lysis of adhesions, where physician will remove or release adhesions from the surrounding body parts like tendon, muscle or nerves. Next one, revision and or reconstruction. So here revision means surgery on a joint or body part previously repaired to again make minor repairs or repeat any portion of the original surgery. So basically revision means reoperation. So what happens here? Patient will have first surgery. So after first surgery, if the patient has any problems, physician will revise the first procedure. Usually we will call it as revision. So basically revision. So seeking or operating again. Next one, fracture and dislocation. So a fracture is a break, crack or disruption of a hard surface such as bone or cartilage. So it is the process of break or crack in the bone or any cartilage. So what is closure fracture? So closure fractures do not break through the skin. So what is closure treatment of fracture? So closure treatment means that no incision is made in the procedure. Instead, the fracture is repaired by reducing it and applying the cast, splint or bandage or any other stabilization device. So basically in closure treatment of fracture, physician will not create any incision and he will use cast, splint, bandage or any other stabilization device in order to treat closed fractures. So here we can see open fracture. So what is open fracture? Open fracture create a wound on the outside of the skin caused by bone puncturing out through the skin under blood vessels. So basically open fracture means broken body part is visible to the naked eye. Next one, open treatment of fracture. So open treatment involves making an incision to surgically access the fracture for repair and treatment. So open treatment is also referred to as ORIF. Otherwise, we will call it as open reduction and internal fixation. Next one is percutaneous skeletal fixation. In percutaneous skeletal fixation are apply here a device or any appliance is placed through the skin across the fracture site utilizing imaging assistance. So what happens here? Here physician will not create any incision or he will not open anything. Just he will put any fixation device or appliance placed using the skin across the fracture site utilizing the imaging. Next one, external fixation devices. So external fixation is any means of securing or fixing bone ends or fragments in proper anatomical alignment from outside the body without nailing, wiring, rodding, screwing, or plating the bones together on the inside. So here physician will apply any type of fixation device on the external surface, or usually we'll call it as outside the body without any nailing, wiring, or rodding or screwing. Next one is manipulation. So manipulation is the process of movement of a joint or body part by the surgeon hand so that fragments of fractured bone or displaced joints are brought into normal anatomical alignment. So basically here what happens, physician will use his or her hands so that fragments of fractured bone or displaced joints are brought into normal anatomical alignment. So basically using the manual pressure, physician will try to repair the fracture. So next one is reduction. So what is reduction? Reduction means same process, but here physician will use manual reduction or surgically. So non-surgical reduction may involve the use of traction. So using the traction devices, physician will do the reduction. So next one is arthrocentesis. So arthro means joint, centesis means aspiration. So arthrocentesis is the procedure to aspirate the joint and remove fluids and or inject a therapeutic substance. So what happens here? Sometimes in order to identify the patient's diagnosis, in order to treat the patient, physician will remove the fluids from the joints. And also sometimes he may inject the therapeutic substance into the joint in order to treat pain. Next one is arthrodesis. So arthrodesis or fusion is the permanent joining together of bones by mechanical implants such as screws or wire or by graft to make them immobile. So usually we will use arthrodesis procedures on the spinal procedures. So in coming days we will learn all these procedures on Passcoder 21 YouTube channel. Next one is arthrotomy. So what is arthrotomy? An arthrotomy is a surgical incision into a joint as an approach to a therapeutic surgery to explore the joint, provide drainage, or possibly remove a foreign body. So basically, arthrotomy means arthro means joint, tomy means incision. So basically, physician will make incision on the joints in order to do therapeutic surgery or explore the joint or provide drainage, which we will call it as arthrotomy. So next one is amputation. So what is amputation? Amputation means detachment by surgical or traumatic means of a limb, body part, appendage. So basically amputation means detachment or removal by surgical or traumatic means. Next one is disarticulation. So disarticulation is amputation of a limb by cutting through a joint rather than cutting through bone at any point of the limb. So basically in amputation, physician will remove the body part at any place, but in disarticulation, physician will remove the body part from the joint area. So articulation means joint area. So next one is arthroplasty. So in arthroscopy, the surgeon makes two small incisions in the skin and insert pencil-sized instruments that contain a lens and lightning system to magnify and visualize the structures inside the joint. So basically, it is a procedure. Here, physician will make two incisions, and using these two incisions, physician will operate the patient's condition using the camera. Arthro means joint, scopy means visualization. So it is like process of seeing the structures in the or inside the joint. So next one is arthroplasty. Arthro means joint, plasty means repair or restore. So arthroplasty is a procedure to restore range of motion by realigning or reconstructing a dysfunctional joint. This includes reconstruction of a joint which may involve replacement of the joint with prosthesis. So basically here physician will do realigning or reconstructing a dysfunctional joint using arthroplasty procedure. Guys, thanks for watching Fast Quarter 21. So today we have completed session 1. Please wait until our session 2. Happy coding coders. If you like this session, please click on like button in order to motivate us.